Let's start with the first part it's a more general vision of health sciences. And José Antonio, we can introduce the first speaker. Thank you and good afternoon. It's a pleasure to introduce next speaker, Álvaro Ruiz Zambrana, gynecologist from the University of Navarra, professor who is here in this university, trained in cardiology and fertility as well. And he's going to talk about the physiological basis of natural fertility awareness. This is something that all of us who work in this field have to know and have to go into depth in order to better help our patients. Don Álvaro, it's a great pleasure. Well, it's not that easy. Well, good afternoon. The first thing, it's a pleasure to be here with you. I thank the organizers who have allowed me to share with you this fantastic program, but with so many important people that we have been enjoying these days. From the medical point of view, the human body is a marvel, and fertility is one of the most complex processes. If we understand its functioning, we will be able to use it for what it has been designed for and how it has been designed. I like somehow to compare it when I talk with people around me, that sometimes not everybody understand the medical issues. Compare it with a washing machine or a dishwasher washing machine, because sometimes we use it just pressing that key that we know that it's going to wash well. But when you read the instructions and understand it, you understand there are many other buttons that give fantastic functions and make the washing machine work better. This is not a washing machine. This is something that is much deeper, as is sexuality and fertility. And I'm going to try to show in my talk the physiological basis of this recognition or awareness of fertility. Let's go ahead. Well, this concern for knowing fertility and fertility awareness has existed in the mankind since the beginning. There are primitive people where they looked for some explanations to fertility in what they saw. The menstruation probably was the most evident. It was mixed with some cultural beliefs or religious beliefs, depending on the culture. Later on, different findings, the sperms in the seminal fluid were shedding some light to this path. And even later on in the first natural methods in 1900 is when they started calculating the days in order to have one of these methods. And then the development, the discovery of different fertility indicators, biological indicators, was possibilitating the appearance of other methods, with the different methods with calculation days that were more exact methods when they have to determine the fertile days. But it wasn't until 1975 or 1980 where they started using the symptothermal method that we recognize this year now of double calculation. These methods of fertility awareness have received different names throughout history, but now we prefer not to use the names. We prefer to stick to methods of fertility awareness or regulation of fertility in order to design this type of methods or techniques. The World Health Organization in 1979 defined the natural fertility awareness as the whole set of techniques designed to prevent pregnancy by means of observing the signs and symptoms that naturally appear throughout the cycle. This was the WHO. This was nothing religious at that time, but it's striking how this has been degenerating with time. Today, it's very important that the only nuance that I add to what the people listen is that we shouldn't teach as a method for awareness the method of rhythm calculating days. It's not a scientific one. Before anything else, and I understand there are people who are connected, who are not from the healthcare environment, a brief anatomic reminder of the male reproducing apparatus. The sperms are produced in the testes. They are then mixed in the semen with a secretion of seminal vesicles, the prostate, and the Cowper glands that enrich it, protect it from the infections, clean the ducts, and then secrete it through the urethra outside. The genital apparatus of the woman, the ovaries, where the ova are produced. There we have the fertilization that takes place in this part of fallopian tube, and then it travels through the tube until the uterus, where it has two different parts, the body and the cervix connected with the vagina to the outer world. Why do I stop at the cervix? Because it's important. We will see that its anatomic structure is different from the rest of the uterus. It has some crypts around the cervical canal where the mucus is produced, and they are very important for this whole issue, and we will talk about that later. The physiological basis, well, all this is controlled by hormones. Let's see what the menstrual cycle is. We know, I insist, I'm going at a very basic level so that everybody can follow me. It's divided in two parts. It lasts 28 days. It can be 27 or 30, and it's also considered normal. Divided in two parts, more or less, divided by the ovulation. The first half, pre-ovulatory, is the follicular phase. The second one, the post-ovulatory, is the luteal phase. And the regulation is quite complex and at different levels. We know that it depends on the one side of the brain, the hypophysis, and on the other hand from the ovary. The regulation is quite complex, but in large terms, the brain is stimulating by means of the hormonal secretion of the follicular growth. The follicle is increasing the secretion of estrogens that have a repercussion on the endometrium, causing a thickening in the endometrium, preparing the endometrium, and then in the cervix, causing changes in the cervical mucus that becomes more fertile due to the estrogens. When the follicle grows, it sends a signal that makes that the brain secretes a hormone that causes the ovulation. That's the peak we can see in the upper part. This ovulation causes the formation of the corpus luteum that secretes progesterone and determines the changes at the level of the endometrium, cervix, and also other levels of the body as the baseline body temperature. And here I represent the chart and the different variations. The hormones have repercussions at the genital level and throughout the whole body. It's important to know how to distinguish it. How is this regulation, more specifically? We've said it depends on the hormone axis formed by hypothalamus, a part of the brain. I will explain briefly where, hypophysis, and the ovaries. How is this regulation? Well, the hypothalamus is a part of the central nervous system that produces GnRH, that is a hormone that produces at the level of the hypophysis, the gland in the lower part of the brain, the secretion of follicular-stimulating hormone and luteinizing hormone, the two hormones that are secreted by the hypophysis and that carry out their action on the ovary. And then, what is the main role of the FSH? Well, it stimulates the growth of follicles in the ovary. And those follicles are those that then bring the hormonal secretion of estrogens. The main function of LH is to cause ovulation, contributes also to the formation of the luteal body that will then secrete progesterone in the second part of the cycle. And this happens in the ovary. The secretion of estrogens and progesterone takes place in the ovary. Estrogens, through the follicle, let's say, and progesterone from the luteal body, each one at a given point in time in the cycle. And in the ovaries, we also have the formation of the ovum as well. There's different phases in the cycle. We have mentioned them. These are two. The first half, follicular phase or proliferative phase, is where we observe a growth of the follicle. The second one, the luteal phase or secreting phase, is where basically we are going to see that the body is getting prepared for a possible maternity. There are a series of changes caused by the progesterone in the luteal body that prepare the body and the whole body, the uterus and the whole body for this maternity. I like to explain this in this way to the patients as a normal cycle. It's the same, the duration. Here it says 29 has two parts. The first half, that last until the ovulation, the second part from the ovulation. The second part is always constant, 12, 14 days, and constant in women. The first half is the one that varies. And this is going to determine the fact that women have sometimes short cycles or long cycles at the expense that this first half is reduced or shortened or lengthened, but the second half is always constant. So if we are able to recognize ovulation, we have a control of the cycle. The follicular phase is this one. What happens, this follicular growth, we call it follicular recruitment. What happens is a group of follicles grow as a response to the call by the brain. It sends its hormones. There is a group of follicles in each ovary that are starting to grow. And the most able to respond to this call from the brain to this hormonal stimulus is the one that grows and makes and becomes the dominant follicle. This selection is necessary because this follicle is the one that keeps on secreting estrogens for the rest of the cycle up to the ovulation. It guides the cycle towards the ovulation. And then after ovulation, the luteal body that is formed from the remains of that follicle secretes progesterone, and this is going to determine the second part of the cycle, all the functions that we've mentioned that prepare the body for maternity. The second phase lasts for 12, 14 days. If nothing else happens, the progesterone levels go down and the luteal body degenerates and we have menstruation taking place. If there is a pregnancy that takes place, the luteal body doesn't degenerate, stays there and keeps on secreting progesterone during first weeks of the pregnancy. And this is what makes possible the pregnancy to stay there until the placenta is formed around the 12th week of the pregnancy. This is fantastic. It's marvelous to understand it. Well, what are the changes at the level of the endometrium? The hormones are recruiting everywhere. In the uterus, endometrium is the internal layer of the uterus, grows in this first proliferative phase, increases its size, thickens the endometrial size, and starts increasing the amount of glands inside. The second half, the secreting phase, that endometrium is transformed. It's become receptive and is prepared for the maternity. And also, here, menstruation depends on this when the hormonal levels, that layer of the uterus until it's discriminating produces then menstruation. There are also changes in the cervix. In the cervix we can observe that there are different features that vary, and also the mucosal secretion with respect to the hormonal changes throughout the cycle. When there are estrogens, estradiol, the cervix produces fertile mucus. When we have progesterone, the mucus changes, stops the production of mucus, and it becomes infertile. And this is fundamental to determine the fertile days. And in fact, because thanks to that fertile mucus and this secretion of estrogens at the level of the cervix, there is mucus produced, the sperms can last longer in the feminine genital apparatus. We will see then in slides later on. We have talked about biological indicators of fertility. The most important one we have already mentioned, and you have seen it these days, is the cervical mucus. The cervical mucus is secreted. I'm not going to enter into detail, but basically I wanted you to have a clear idea that around ovulation, the fertile mucus has characteristics that are clearly recognizable, elastic and transparent, compared with the infertile mucus is more sticky and whitish, and women are able to define it and differentiate it. We have seen that. It has differentiating characteristics, and this has allowed us to know that there's a point in time in the cycle where the sperms are not able to go through this mucus barrier. They stay there, stopped and blocked, and another moment of the cycle where a series of channels are produced that favor the coming up of these sperms, and they nourish them there. And this is also Erik Odeblad. This is from Erik Odeblad that has been mentioned this morning, and all his work as well. This discovered what types of mucus there are, where they are produced, when they do appear, and all this is basic for what we know today as indicators of fertility in the mucus. There are different types of mucus. It has already been said for many years. In 1977, he discovered two types of fertile mucus. The fertile mucus, there were two subtypes. the mucus S that forms the channels through which the L mucus is ascending, that traps the low-quality sperms and allow the high-quality sperms to go higher up, because these are going to be fertile. The mucus P is produced in a fertile period that is liquefying, and the feeling is more aqueous, is more watery. And then also the G mucus, that is the infertile in the rest of the cycle, that closes the cervix and doesn't allow the passage of sperms. Those periods in the cycle where they are produced, I'm not going to talk about them so much, but I would like you to see the difference of the mucus. Basically, the fertile period around the ovulation, the mucus is more watery and forms channels that facilitate the passage of sperms, and the rest of the cycle, it's infertile and blocks the sperms. What does the woman notice? Well, differences that are subtle but quite recognizable. In the periovulatory period, this mucus is elastic. It's defined as humidity, being wet and lubrified, against the rest of the cycle where there is dryness, and the mucus is less elastic. And also, we can see some changes. Another indicator of fertility is the position of the cervix. The hormonal variation that happens throughout the cycle also determines change at the level of the uterus and its ligaments. And we can recognize changes in the cervix according to if there are low estrogen, the cervix is lower down, it is closed, and it has a firm consistency compared with the cervix when the estrogens are high and the cervix is higher up, more open, and the consistency is softer. And this is easy to recognize. And even during the period after maternity, in which when there are fertility signs, the woman, even in lactation period and even who doesn't yet have the menstruation, is able to recognize those changes in the cervix, in its consistency, its position, the mucus secretion that are appearing. Temperature is another indicator. We have also mentioned that. And it suffers variation throughout the cycle with respect to the hormonal secretion that is produced. We know that, as I say, it's post-ovulatory elevation, very subtle, a couple of tenths of a degree. We have to be aware of it, and we have to take the temperature at a fixed hour in the day, but it's quite reliable. The person who is able to do it consistently, well, this is a very good indicator and reliable indicator. This is a chart that we would see in any user of natural fertility awareness methods. I'm not going to stop any longer at that. In order to finish, what are the means that we have to detect ovulation? Well, by nature, the women are able to recognize changes in the temperature, we've said, changes in the vaginal flow, in the cervix, and also some of them feel some pain around the days of the ovulation, periovulatory pain. Not all of them, but it's quite frequent. And when they are trained users with these methods, they are more able to recognize the whole of these methods. But there are also auxiliary means that help to this recognition. For instance, ovulation test, very well known in different formats, but basically it's positive when one detects in urine the presence of LH, the hormone that we saw before, the luteinizing hormone. And the trick is that we have to start detecting it soon in the cycle. If you remember, the peak of LH was a very few hours before ovulation and lasts a very short time. If we make the test too late, they come too late to the ovulation or don't detect it. But it's help for some women. And also ultrasound, we've seen that in the talk by Dr. Alcázar this morning. We are able to make a follow-up of the cycle where we can see the changes that happen at the endometrial level, at the ovarian level. So we are able to differentiate the proliferative phase of the cycle with the characteristics of the endometrium against the secondary phase, and also the follicles and the formation of the luteal body in the ultrasound. This is also a very useful tool in order to study the cervical mucus for those women who sometimes are not able to recognize it. We can measure it And we've seen in different studies, here I show one, that it is quite reproducible and reliable, this assessment. All this for what? And now I finish. Well, the important thing is to be able to recognize the fertility window that we have already mentioned. But if we're able to determine which are the fertile days, it would be fantastic that everybody could leave from here with a clear idea that out of the whole cycle, there are only a few fertile days. The rest of the cycle, it's not possible to become pregnant. This is basic to understand fertility as we know it here, and for people to be calm and living their sexuality and their fertility. And this is the basis of the natural fertility awareness. And that was all. Thank you very much.